Respected session chair and all the delegates. My topic is low body mass index in pediatric orbital and ocular malignancies, a key prognostic indicator. As we know that body mass index in most of the diseases we are utilizing, it is very easy. By definition, individual body weight divided by the square of the height is the thing. Is a very easy method to calculate, and most of the diseases in diabetes, hypertension, we are using this. But in case of a cancer, large number of studies, it is highlighted as one of the associated factor. But none of the studies are thinking on that way that is there any role of body mass index on that outcome. But there is enough data to correlate. There is some studies are there. They are analyzing in last. There is in some cancers there is a high body mass index, and in some cases is not inconclusive. But in head and reject there is if there is a body mass index, the outcomes are good. Purpose of the study was to aim of the study to evaluate the role of BMI as a prognostic factor for ocular and orbital tumors in case of a pediatric age group. The study was a prospective case control study carried out in eastern part of the India in a 3 tertiary care hospital in a period of 10 years. In between January 2007 to 2017, ethical clearance from each individual institute was taken. Our body 170 pediatric ocular and orbital malignancies. Out of that, 137 were ocular and 33 were orbital. The cases were identified directly by the investigator. The newly diagnosed cases were enrolled in between 2007 and 2012 only. As in ocular mortality, it may goes up to, you can consider up to 5 years. That's why we just recorded up to another 5 years. And patients were also required to be less than 18 years at the time of presentation. And of course, most of the population are very less, and control group, same age of the same locality were taken, is a control group. And BMI was used as a mean correlation between the control and the disease group, and independent t-test was done in each cases. Those are the case distribution. In this case, of course, retinoblastoma is the one of the highest, 125 out of 170. Then other intraocular, including leukemic deposit, malignant melanoma in one case, and in medullary is one case, and rhabdomyosarcoma in orbital group with myeloid leukemia deposits, and other neuroblastomas are the other 33 cases. Once we examine the mean cases in case of the ocular, then there is a significant, including all a control group, and that there is a significant in a t-test. It has a p-value is very, very high, and it was a very, very significant. Then again, we are for disease, if we look on the results, out of 125, out of 26, out of 126 were dead, and that is little bit high as per our national or international. But when we evaluate, out of them 26, 18 was where BMI was less than 18.5. Or if that BMI is normal range, then mortality is less. Of course, this is one of our patients who is after the chemo, and suddenly due to the pancreatic mass, patient developed a bleeding. We just cauterize, patching given, again that we can continue the chemo. That patient also, as per the literature, that type of patient is impossible to survive. But as that patient's BMI was very high, 23, and this is the patient after chemo, and we did the enucleation, and we did follow-up for last 5 years. Now he is going to the school. Again, in orbital group, the same thing. We just perform the both BMI in control and age groups, and here also it was very, very significant. And here also, if we consider, of course, our mortality is little bit high, and that's why we want to do this study. And in spite of all those things, that mortality is 4 out of the 12, and out of that 4 and 3, almost 75% from a low BMI group, and 25% only from a normal or adequate BMI. That is another patient of rhabdomyosarcoma. Debulking was done, then chemo performed, and that almost with a minimal doses because of the surgery, minimal doses used. There's no recurrence, nothing till for last 5 years. So that in again the leukemia also, if we look all other percentage wise, that is very, very high in case of a low BMI. If we look all the tumors in again, then also that is very, very significant. Is the standard deviation is of course high, and it is very, very significant. On that ground, we want to say that BMI is a prognostic factor for malignancy, has not been properly explored, though it is a correlated as a risk factor. It was initially labeled. In the literature, it has been documented that cachexia is linked, especially in case of a lung cancer and etc. But all are different. Elementary cancer is different. Head and neck cancer is different. As orbitinonuclear is in the region of head and neck. None of that study still now explore those things. This is the one of the very pioneer study. This study of the BMI was calculated at the time of diagnosis. I am completing. On that all, we want to conclude that low BMI at the time of first diagnosis is a significant factor for high rate of treatment failure. Of course, in this is a sample size, all types of stages was included, and inadequate previous data of BMI was another drawback in our study. Those are some reference. Thank you.